This section of the assignment is for special populations. I'm going to talk about people with lower back pain, high blood pressure, and shoulder injuries. One thing to make sure when you train anyone with these conditions is to make sure they have undergone appropriate evaluation by the necessary medical or allied health professional and they have been cleared for exercise. I'll start off with high blood pressure, which is also known as hypertension. It's a condition of elevated blood pressure, which is a reading of 140 over 90 or more. There are a lot of risks when exercising with this condition, so it is important to be aware and informed of the condition. Hypertension can be caused by a number of lifestyle factors such as smoking, drinking, poor diet, lack of exercise, obesity, and many more. The condition can improve with regular exercise and making healthier life changes such as improving diet. It is good to seek medical clearance for clients with high blood pressure. Low intensity exercise to moderate intensity exercise is recommended rather than moderate to high intensity exercise, so that we avoid putting too much strain on the heart. It is also good to use high reps and lower weights compared to heavy weights and lower reps. And it is also important to have longer rests so that they can get their blood pressure a little bit back down to normal, and so it's not going to make their heart work too overtime. Make sure the client has steady breathing throughout the workout. It is dangerous for them to hold their breath as it could make them dizzy and lose balance. It is important to choose more aerobic exercises such as swimming, cycling, and walking rather than isometric because it will raise blood pressure too rapidly. If the client did want to perform more muscle building exercises, it is recommended to use more unilateral exercises, isolating one side at a time. This will reduce large spikes in blood pressure. They should participate in 30 minutes of low to moderate exercise 5 times a week, or moderate exercise 3 times a week for 30 minutes. In my session today, I would have changed my interval session for someone with high blood pressure, as burpees and squat jumps are not appropriate, and instead I would do some interval training on a stationary bike. The next condition is lower back pain. Clients with this condition either have acute or chronic back pain, and it all depends on how long the symptoms last. Acute symptoms are less than 6 weeks, whereas chronic symptoms can be more than 3 months. Dull to short stabbing pains can originate from poor posture or from a previous incident or accident from the past. There is a few things that they can do in their own time, one of which of these things is regular exercise, which will speed up recovery and also reduce the pain. However, there are a few exercises that could potentially harm or make the injury worse. So it's important to contact a doctor or a physio or an appropriate allied health professional to give them clearance to exercise. It is important to avoid exercise that will strain the lower lumbar area, such as a deadlift or a weighted back squat. It is important to focus on strengthening the core muscles, the gluteus maximus, quadriceps, and the hamstrings to support their core movements. Action around this injury does depend on the severity of the pain. You need to check regularly with the client to see if they're experiencing any additional pain. If so, stop the exercise immediately. So important cues to use while coaching someone with lower back pain is to constantly engage the core, maintain a good posture, and keep your shoulders down and back at all times, and avoid slouching when possible. Improving core strength will help support and take the pressure off the back muscles. To modify the session today, I would do a seated squat and take off the weight depending on the severity of the back pain, so that it could just be a body weight seated squat. This isolates the glutes and the quadriceps, so you're still getting the same muscle activation. It just takes the pressure off the client's lower back. Okay, the next special population I wanted to talk about is the shoulder injury. It is very important to get in touch with your client's GP or allied health professional, so we can better get an understanding of the injury severity and work out the appropriate session plan to accommodate for the injury. Shoulder injuries can be very problematic to athletes, and there are many types of shoulder injuries, but I am going to use shoulder tendonitis as an example here. This is a common sports-related injury. Clients with this injury will feel pain with exercises that are above their head. We need to make sure that they avoid this movement and replace it with front raises or lateral raises to ensure they get the benefit of strengthening this area still.